Hey guys, Reed here. We have a very important discussion today. I think you should probably turn the TV off, sit down, and just listen to Reed. Give me your attention for like 5 minutes. Well, make it 10 minutes or make it 15. In fact, I should be the only one you listen to at this point because this information I have is just that important. I began this series called The Singularity is Here. It's probably the most important subject you're ever going to have. This is the conversation about the change in humanity, right? COVID 19 was the end of the Industrial Revolution, and we are blessed to be at this point in human history where this transition is happening. And so that means that we have an opportunity to get out of all the vices, the systems that were created in the industrial revolutions, contain us in, and we're able to escape those devices or those structures and enter the information age, which is an age about you, not about the structures that you were in. The Stone Age were about stone, right? The golds were about gold, right? The bronze was about bronze. Agriculture was about plants. Industrial revolution was about factories and the means of production, right? And when that human era is done, you know, we don't need factories anymore. We don't need those type of organizational structures anymore. None of those things work anymore. Well, they work, but they work at the level of the information age. They work at the level of the industrial age. But we're in the information age, and so none of those systems are going to be compatible anymore. Because of this transition, the transition to the information age will create a new class of people that's never really existed at this population or this scale before in human history. And these are going to be people whom the economy or whom the people who own the resources don't have a use for you anymore. This is bad. You mean a new category of humans where they won't have, the people who run the economy won't have a use for you? Typically, if no one has a use for you, who comes to your defense? No one. So I'm looking around the south side of Chicago and I'm starting to look for evidence of the singularity. And the singularity is the point where computers become more competent than man. And so we're going to see mass rejection of the current systems that are failing and mass adoption of the new systems because the people are going to run for their lives, right? They're going to run for their lives, right? And when the information age is here, this category of useless people, I'm looking around the south side of Chicago to see if there's any evidence of that's going on now. How do I identify people who would be considered useless? Track unnecessary deaths, track unnecessary suffering. Remember in the previous discussion, go back and look at my video that on the south side of Chicago, unfortunately in Chicago, on the south side and on the west side, children make up 20% of the murders in the community. It goes on, the community doesn't do anything about it. When the community abandons 20% of its children, it's not a community. It's a collection of people living in close proximity, but that's not a community. I think a community will protect its most vulnerable. So I'm not sure if we can actually call the south side and the west side communities anymore. The second thing is we looked at the sheer number of children who are missing every year. And it just so happens that the majority of the people who are missing are girls. right? Look at the duality here, the dissonance here that's present on the South Side. The murders are for the men, but the disappearance is for the young girls. I'm sorry, the community allows over these hundreds, close to 1,000 young girls every year to just disappear. And where are all our leaders at? Where are all of these young girls going? Right? So when I look on the South Side, I see just murders that 80% of the murders are unsolved. They're not even looking. It's too many. Children being murdered, children being abducted. And now I'm looking at another area in healthcare. And I think I may have found another area in healthcare where useless people who are considered useless by the system are being preyed upon. And look at this statistic here. So I'm going to go to the AI as usual. I'm going to go ahead and go here. And let me just text him. Explain how many people each year die in hospitals due to medical. And these are just errors. Jeez. I wanted to go on the low end, so I titled this over 300,000 people die in hospitals. I did the middle number, right? Estimates of deaths in the United States hospital due to medical errors vary, but major studies suggest the annual number is in the hundreds of thousands. Some figures placing the total between 250 and 440,000 people. I said die each year. 2016, John Hopkins, 250,000. The 2013 meta-analysis using the global trigger tool, what is that? Found significantly higher number, potentially reaching 440,000 deaths due to medical errors. This is very concerning. And how is it that you have a body? You have a body and you don't know how the body died? And how is there a difference between what? Close to 200,000 people? What goes on the death certificate? And who signs the death certificate? So I'm concerned about this, very concerned about this. Why are the numbers so high? Many medical errors are not due to individual negligence, but systemic problems within the healthcare, such as inadequate staffing, errors in judgments, or deficits in care, right? Or intentional. They should have intentional down there. This shouldn't be written. These articles should never be written fully from the perspective that this is all due to error. No one ever considers anything intentionally. Preventable harm. Yeah. And the Institute of Medicine 2002, error is human, highlighting the significant problem of medical errors, with some studies indicating that a large proportion of adverse events and consequently deaths are preventable. Yeah, let me look more into that. And this is when I start thinking about in terms of people who are determined to be useless. You know, when people act upon them, they can remove them from this environment, and no one says anything about it. And look at all of these people going through this portal. I think, remember, look at the scale of this. This is like a war. This is like more death every year due to errors in healthcare than war. Okay, let me search even further. Okay, well, let me see if I can get, this is an AI engine, but they've had, let me see if I can get Grok. Okay. Okay. Let me try to use the free version until they until they don't have a free one. And then I haven't looked at Chat GTP yet. I don't know, I gotta look at that. Okay, so here, um, let me see. Naperville and the city of Naperville. Okay, compare. Okay. So we want to look at morbidity and mortality rates, right? So we're going to look at this, if the patients on the south side are sicker and dying more than the patients in other areas. And so let's try to see if this harm is localized on the south side. If it's localized, then someone enforces the boundaries, meaning someone is actually working in the community performing these type of things that's resulting in an outcome if it has a boundary, right? Because the people have to be taken care of in the location that they die. So people come into the community and take care of you, take care of the patient. I'm trying to see if it's something like that. The overview of morbidity and mortality on the south side versus Naperville. The South Side Chicago refers to a diverse, predominantly low-income African-American region encompassing communities like Inglewood, Washington Park, Woodlawn. It faces significant health disparity due to structural factors such as historical low segregation. In 2025, poverty, limited access to health care, food insecurity, and high violence rates. In contrast to Naperville, a suburb in DuPage County, 30 miles west, is affluent, predominantly whites, and ranks amongst the healthiest healthcares in the United States, with excellent access to resources, low poverty, and strong preventative care, right? The differences results in stark contrast in morbidity, illnesses and chronic conditions, and mortality. Okay. I don't know what the study is going to show up, but let's look here. Okay, life expectancy, mortality indicators. Life expectancy reflects overall mortality risk from chronic diseases, right, violence, and other factors. Chicago's overall life expectancy dropped nearly 2 years from 2019 to 2020. This is 277. This is significant. I mean, if you live on the south side of Chicago and you just received this drop in life expectancy, where are all of our leaders at? I mean, where are the people who are supposed to address this? You know, with the largest decline among Blacks and Latino residents, the South Side Naperville gap is part of a broader 30-year intra-Chicago disparity, i.e., 60 years and 90 years on the north side, but Naperville extends to the suburban contrast. Okay, so look, geez, look at this. This is awful. Look, the life expectancy is almost down to like 55. That's like third world countries. And here, 85 to 90. Okay, south side driven by homicides. Look, 15 to 34. You see that age group of the children again? Heart disease, diabetes, that's the older folks. Naperville, low violence, high preventative care. Okay. Life expectancy for Black residents, 69 to 72. Chicago-wide, but South Side is 90% Black. And look, 81 to 84 years old. Post-COVID decline, a 3-year drop for Black residents. COVID deaths on the South Side zip codes saw 2 to 3 times higher death rate due to comorbidities. I remember during the COVID times, they were even taking the vaccines and moving them to different communities. And that's how could someone take vaccines designated for one community and then make a decision to move that to another community and no one says anything about this? And then now here's the higher rates and comorbidities. Okay, so these are the mortality indicators. Okay, let's say mortality rates, cause of death. Okay, the mortality rates per 100,000. So basically, between 1,200 and 1,500 people die per 100,000. This is down to 600 to 800. Okay. Right. Homicides and violence. Yeah. 30 to 50 in Inglewood and 40 plus in other areas. Look, gun violence near zero in recent years. This is showing us that violence and that the issues that we're experiencing on the South Side and West Side of Chicago are not issues that's intrinsic to the African American people who live there, right? Because these things are not present in other communities, so therefore they're not requirements on the South Side. I think at some point in 2025, I think the healthcare providers, I think we need a new generation of leaders who are going to not be silent during this very important epidemic that's going on, this silent epidemic that's going on the South Side of Chicago. I think we need leaders to actually stand up and say, hey, we need to address these things. We need to have leaders that say, hey, you cannot take vaccines during a pandemic out of our community and give it to your community. I mean, do you know how many people were impacted by that? And the people who had to suffer under those circumstances, who lost family members, who's lost things, I would say they would be considered useless. Because if anyone can just decide to remove a community's vaccines through a pandemic, I think that should be a major issue. I think that should be a Department of Justice issue. You mean the lives in the South Side of Chicago are less valuable to where these people took the vaccines? So this is something interesting here. Okay, heart disease. And so these are more chronic stuff: heart disease, cancer, infant mortality. Between 15 to 20 babies die, infants die. This is 6 times compared to Naperville. And look, only 4 to 5 incidents of this happening. Okay, then COVID, 300 to 500 deaths. COVID. Look at this. From COVID-19, for COVID-19, the mortality rate was 300 to 500 per 100,000, whereas in other affluent areas, 1 to 150s. But then they took the vaccinations out of this community and took them to other communities that were more stable. Actually, I'm gonna look into I'm gonna see if I can look into the vaccine distribution on the South Side of Chicago and see when they assigned vaccines, when they removed them from the community, who removed them and where did they go. It'd be interesting to see the communities they went into. Morbidity rates, chronic conditions. Okay, so these are just like chronic things. Like this is morbidity and mortality. So things like that happens in the hospital. 35 to 40% rate. Look at this: diabetes, 15 to 20%. 5-time amputation rate versus whites. Okay, in Gary, okay, here, hypertension, asthma, mental illness, PTSD, suicide risk. Maternal morbidity, 74 in 10,000, 74 in 10,000 deliveries. This is not 100th. This is not 100,000. This, this, this is based upon rates of 100,000. This is a tenth of that. So that's 74. 74 per 10,000 when compared to 40 to 50. Okay, key disparities, structural factors, socioeconomic, access and projection, COVID trends. Okay, let me search this, and I'm gonna search to see, is it illegal? Let me see if I can. I don't even know. Is it legal for someone to remove vaccines during a pandemic to a different community? I don't even know if I asked the question correctly, but I'm trying to say, hey, in times of this global, when the world is shut down, when they designated vaccines for our side of for the south side, the side of town I was born and raised in, when they took these vaccines and took it to other communities, is that against the law? Or do the people who did not receive the vaccines, do they have um, any type of say so? The legality of removing vaccines during a pandemic to a different community depends on several factors, including specific content, jurisdiction, application, ownership. Vaccines distributed during a pandemic are typically allocated by government and health institutions. Right, removing vaccines from one community to another without authorization can be considered theft, misappropriation, or diversion of public health resources, which may be illegal. Right, and that's what happened on the south side of Chicago. Public health regulation during a pandemic emerged. Okay, we know that emergency health regulations govern vaccine distribution to ensure equitable access. Unauthorized removal could violate these regulations, particularly leading to criminal and civil changes. Okay, intent and content. If someone knows this stuff, let me know. If someone's good at this stuff, if someone can find the vaccines that were distributed on the south side of Chicago, what government organization distributed them, and how were the vaccines supposed to be administered, delivered? Because I think we need to find out as a community whether or not it's legal to remove vaccines and place them from one location to another one. Jurisdiction, okay, intent. If the removal is done with the intent to harm one community or profit another, I think these people took a vaccination truck and took it to their community and started vaccinating everyone with it. And I think it does to profit one group over another. It could lead to charges like theft, fraud, or bioterrorism. Jurisdiction laws vary by company and regions. For example, in the US, diverting vaccines could violate federal laws under the Public Acts, or, okay, yep, intentionally, yep. Practical examples. During COVID-19, there were some cases of vaccine diversion, black market sales, or unauthorized distribution. Such actions led to investigation and prosecutions, as seen in the 2021 report of stolen and missing allocated vaccines. Let me copy this, and let me see here. Let me see if I can get a list of the stolen or misallocated vaccines. Florida State Hospital theft, Chattanooga. 2 vials of Moderna, each containing 10 doses, approximately valued at $5,000 per vial, were stolen from the hospital's medical storage unit. No suspect was identified at the time. Okay. Strawberry Festival found, fairgrounds car theft. Okay. Hospital storeroom theft and return. Okay. Dental office burglary. Vaccine cards. Additional context. Yeah. Okay. So it'd be interesting if someone can sort of review this because I want to see about that. I want to see how do we see whether or not the vaccine distribution on the south side of Chicago was legal or not. And I think we should also see, get a good idea of how many people missed out on vaccines due to this diversion program they had. Um, so, so let me get back to the goal here. Let's see here. Let me actually take some questions. Okay, so here. Okay. Hey, buddy, how's it going? What's a great choice? What a great choice for a topic no one talks about. This is one of those gray areas. You know, when you start saying things, people start getting uncomfortable. But I'm that personality type, so it doesn't really bother me much. And it's a very important thing for us to start dealing with now in 2025. You know, Dr. Liv, yes, it's quite unfortunate. Yep. Yeah, iHash, how's it going? 300,000 is a big number, and it's a big number that's being ignored, right? Where are all our leaders at? Where are they at? You know? Um, Dr. Liv, thanks for your comments. Appreciate them. It's also a fight against the mindset and misinformation that the low income communities yield to have. Yeah. Have you heard the lyrics of the Bob Marley song called Redemption Song? It speaks of the disparities. Oh, don't bring up redemption songs. What do you say? Free yourself from mental slavery. No one else can free our mind. Don't forget about the, because none of them can be accepted. How long will they kill our prophets while we stand by and watch? That's what he said. But Marley said, how long will they kill our prophets while we stand around and look? Some says it's just a something, but we have to fulfill the book. So he's saying, some say it's just a, say we have to fill this chapter in this time. And I think we're at the end of the redemption song is an excellent opportunity because in redemption song, Bob Marley spoke of the overwhelming oppressive structure that existed around all of them Jamaicans at the time and how brutal it was to live under that type of colonialism, racism, and the structure. And you pick up elements of that here on the South Side when you see how cruel it is to take vaccines during a pandemic from a very poor neighborhood and give it to you rich folks. You know, give it to your rich folks. That's what it's for. Okay, so this is the end of this discussion. Now, if you please like, share, and subscribe. If you have any comments, go ahead and put your comments down. In this series on the singularities here, I'm going to look for more people who I would consider to be in that category of people who don't have any use in the economy. And what happens is if you don't have any usefulness in the economy, then these predators, they exploit you. And we see it coming up in just unexplainable, just unnecessary deaths. Look at this. Look at the number of men being murdered every year. Look at the number of children, over 800 a year. Over 20% of the children are murdered and never solved. They're never solved at all. Look at the number of children, particularly young girls between the age of 12 and 20, who go missing every year and they vanish. They vanish. Look at the number of deaths that are happening in the hospital you can do an autopsy, you can find out why a body died. and they don't know whether or not it's 200 or 400. What do you mean you can't account for 200,000 human beings who just passed away within the last 12 months? But they can track every penny, right? Uh, so the next talk is going to sort of pick other areas to sort of identify places on the south side where people are being exploited. And this exploitation is fatal. And I'm trying to cluster all these to try to help people on the south side understand that the presence of all of these structures inside of the community you live in, you're going to have to be aware of all of these structures, where they at, how they operate, the people who are operating these structures. Yes, these structures are actually operated and maintained by people. And many of them have to come into the neighborhood and get hands-on contact with the people that they're exploiting. It's hard to just do this remotely or just do this by legislation. You have to have narcissists, psychopaths, and sociopaths on the ground actually carrying out these plans and creating the outcome. You know, so it'll be interesting to see where all of these things lead to. But I would have to warn you, it's probably a good time to start thinking about migrating off the south side, because as these systems collapse, I think these people who don't have value in the economy are where you can make your profits up. You can steal things from them, like their healthcare dollars, like your dollars for law enforcement or dollars for, you can steal those and then just let the person drift away into one of these systems that unalives them and just makes them disappear on their own. And so you get the resources from them while they pass through the system that they set up. And in their system, nothing's monitored, so no one knows what's going on, right? So I grew up on the south side of Chicago. I grew up in DCFS. I grew up in Hirsch. I went to Hirsch High School down the street from in the Hirsch High School. And I understand how the South Side works. It used to be a very vibrant place, and now I'm starting to see that it's not as vibrant. And I believe I'm seeing the early parts of depopulation, you know, and I think the depopulation is going through areas like Roseland now, like areas like Inglewood. And I wonder if there are structures inside of those communities that promote the disenfranchisement and this status for the patients. So stay tuned, folks. Next episode, I'm going to look for another area, and hopefully I can shine some light in that area. But until now, this is Dr. Reed out, Reed Matrix. If you be careful, I would consider getting off the south side. Until then, I'll see you guys later, and hope you follow my next stream. Reed out. Take care, guys. Ciao.